everyone, my name is Vinod Sharma. Welcome back to another podcast of DCC. Today we do have Dr. Vinod Sharma, Director and Head of Veterinary from DCC Animal Hospital. So we have been receiving a lot of queries about euthanasia. So what is your advice to other people how to, handle all those situations?
When it comes to euthanasia, it's a very sensitive topic. I'm also a human being, but I'm professional. Taking a call on putting the animal to sleep, it's not an easy call. Not an easy call for the pet parent, not an easy call for the doctor also. And, take a decision, it takes a whole investigations, emotional, even your medicinal, situational, everything. It's not one that you just give a call that I want to put him to sleep, or the owner comes to me that I want, my dog to be put down. No, it is something very close to my heart or somebody else's heart who love animals. And reaching to the point that I want to put them to sleep, it's a huge decision. It takes a lot. For me, even I remember my first dog. He lived around 16 years and he suffered with a kidney problem. And then he had other issues. I tried as a veterinarian. I did my best, but he was suffering. Suffering at the age that he could not even got up, could not even just do his job. Epilepsy, vomits, diarrhea, and age. And thing came to me, suffering. Suffering is something we should not allow to happen. Because at least we have this liberty or freedom. But how to judge it, that whether he's suffering or not, that is a question mark, always remains in the mind of the veterinarian also and the animal lover also. I had to take my decision on my pet also, and I had to put him down because he was really in a bad shape. And medically, there was a limit that I can do something. I cared, I looked after him. But after certain, days, I have to take a call. So it's not something you decide immediately. No, it takes a lot. And for pet parents or animal lovers, I can understand. We spend, years and years of all love, care, companionship, partnership, and we remember all those jolly moments and time spent with the best loves. It's a tough decision. It's not everybody's cup of tea, and it should not be actually.
Exactly.
So these decisions are very difficult, and it should be taken with a proper advice. Advice should be taken from the family, from the vet. And if you are you feel that you want to consult somebody else also, the second opinion must be taken on that decision.
Sure.
So it's quite tough to take a call. Because this giving a life every day in the practice, you save so many animals. And when it comes to euthanasia, those moments, they always hit you all your life. Because it's not a normal call, it's a very serious call for us.
What would be the common feature the pet lover should notice?
See, when it comes to diseases, there are many diseases you can't really treat them. Some diseases are you can really care about. When a limit comes, you can't manage. Medically, doctors, they give up, okay, we can't do much, like spinal cases. There are now, veterinary science is improving so much. The doctors are there who can treat spinal cases, but in few cases also you can't really help much. Accidental, like some viral diseases I will talk about, you can't treat now. There are options that people, they do take care of the things and they manage them well, they carry on for years and years. But when it comes to suffering, one has to see whether I should take a call or not. He should not let any animal suffer. Yeah. My decision would be on the suffering, that we should take a call when we feel as a pet parent or as a veterinarian that the animal is really suffering and struggling for the death. That is the time that we should take a call. And taking a euthanasia call or putting him animal to sleep, it hurts. It's like you relate it with your karma, you relate it with your dharma. I think the best karma and dharma is your care, your love, and your understanding about your animal. Like, so you have to be very careful about it, that when you take a call, it's not easy. And लोग कहते हैं सर मेरा मेरा धर्म अलाउ नहीं करता या मेरी कॉन्शियस अलाउ नहीं करती. आई एम फुली विद देम. बट कभी कभी लाइफ में ऐसे डिसीजंस लेने पड़ते हैं जहाँ हमारी आत्मा कभी अलाउ करती भी नहीं है. और काश एनिमल ऐसी भाषा बोल पाता कि सर मुझे लाइक मी फादर और मदर और वॉट एवर दे प्लीज़ लेट मी गो, तो शायद हम वो चीज़ को जज कर पाते और उसको आंसर कर पाते. लेकिन वो ज़बान से तो बोल नहीं जाता, हमें उसके सारे के सारे बॉडी लैंग्वेज, उनकी आंखें, बिकॉज आंखें अपने आप में शायद पूरी कहानी कहती हैं. हम कहते हैं ना कि आंखों में सागर है, और प्यार करो तो किसी से आंखों में देख के प्यार करो. सेम में कोई भी जजमेंट लेना हो, सच का या झूठ का या अच्छे का या बुरे का, आंखें बोलती हैं. आपकी बॉडी लैंग्वेज आपके बारे में सब कुछ बयां करती है. सेम वे आपको अपने पेट के बारे में उसकी आंखों में झांकना चाहिए, उसके बॉडी लैंग्वेज को झांकना चाहिए, उसकी मेडिकल कंडीशन को देखना चाहिए. और लगता है कि अब सफरिंग है, तो शायद हम लोगों को उस वक्त ये कॉल अकेले नहीं लेनी है. फिर भी क्योंकि आप अकेले डिसीजन लेने वाले नहीं हैं, आपकी फैमिली भी है, सबका एक डिसीजन होना चाहिए, बिकॉज सब प्यार करते हैं. दूसरा, आपका वेटनेरियन जो उसको पुट डाउन करता है या वो डिसीजन लेता है पुट डाउन करने का, उसके लिए भी आसान नहीं है.
एंड डॉक्टर, कैन यू एक्सप्लेन द प्रोसीजर कि स्टेप वाइज फर्स्ट स्टेप कौन सा होना चाहिए, देन हाउ टू प्रोसीड?
यू मीन हमें कॉल कब लेनी चाहिए और ये कैसे कैसे हो, इसको प्रोसीड कैसे करते हैं. सबसे पहली चीज़, जब हम ये डिसाइड कर लेते हैं कि, और आपका वेट कहता है कि यस नाउ द टाइम we have to say goodbye to the loved ones, my pet. First thing that we should look out that how we are going to dispose it of. Dispose in the sense हम उसका funeral कैसे करेंगे, हम उसका burial करेंगे या crematorium जाएंगे. First inquiry तो हम लोगों को वो देखना होता है. उसके बाद जब हम decide करते हैं कि now the process has to go, so you have to go to the veterinarian जो आपके डॉक्टर हैं, जिनकी एडवाइस पे आप ये कॉल ले रहे हैं, उनकी सहमति से, नॉट एडवाइस बट सहमति से. जब हम लोग कहते हैं कि यस, so there is a particular form, you have to just sign it. Yes, I am giving my consent to the team and to the doctor that please take a call for my pet. So putting him to sleep, which is very emotional when you sign something on the paper. So you have to have big heart for that. Then we have some drugs, which is excess dose of some anesthetic drugs. We just administer IV, उसको IV देते हैं. एंड उससे पहले जनरली IV, ये तो प्रोसेस मैंने बता दिया, बट थोड़ा समय उसके साथ बिताना चाहिए बिफोर गिव हिम लॉट ऑफ लव एंड वॉट एवर ही वॉन्ट्स. यू हैव टू जस्ट एज ए वेटनेरियन हम लोग भी सबको कहते हैं थोड़ा सा टाइम उसके साथ और स्पेंड करिए, बिकॉज लास्ट गुड बाय is like you have to remember that. And then, as I said, we take that injection and we just give it IV, small prick. It should be painless. This is something every veterinarian and every pet owner should look in this, that when we put down animal, it has to be absolutely painless. No suffering at that time also. So take every precaution and every care, all type of surroundings, that pet should be comfortable and the family should be comfortable. So we give that in excess dose of anesthesia, and then it happens. We wait for the heart to stop and biological process to stop, and then we just take the body and go to the crematorium. This is the routine procedure, but the last moments of the pet should be absolutely painless. make sure that it has to go painless. Otherwise, you are doing a crime.
Okay.
You are taking a call, and that's even putting animal to torture. It's not good at all.
Because it's been very difficult for me.
It's emotional for me. I remember I had, as I told you, I had to put my dog to sleep, and then still I remember him. It's not easy to forget or to like to overcome that, but your emotional folds and life has to go on. So you have to like slowly, but that things always remains your mind, because you remember you can't really come over it 100%. इमोशंस आपके रहते हैं, प्यार आपका सदैव जिंदा रहता है. कभी कहते तो है ना कि प्यार छूट जाता है, तोड़ मतलब भूल जाते हैं प्यार को, कोई नहीं भूलता. चाहे वो आप और हम किसी से प्यार करें, पहला प्यार सदा याद रहता है, दूसरा भी रहता है, तीसरा भी रहता है, चौथा भी रहता है. और पेट्स के मामले में तो पड़ोसी का भी पेट याद रहता है, उसका भी प्यार हमें हर समय महसूस होता है कि वो नहीं है, वो चला गया. आपके पड़ोसी पूछेंगे आपसे कि नेम विद योर डॉग्स नेम, पेट्स नेम, कि वो कहाँ है, क्या हुआ, सो इट्स बहुत मुश्किल है उसको भूल जाना. मुझे इफ़ यू आस्क मी, आई एम स्टिल रिमेम्बरिंग माई पेट, इट्स इमोशनल. सो बहुत मुश्किल है उसको ओवरकम करना. इट्स नॉट ईजी. इट्स गुड टू बी ए पेट पेरेंट. आप हो जाते हैं, पेट रख लेते हैं, बट आप ये भूल जाते हो कि आपके साथ उसके कितने इमोशंस जुड़े हुए हैं. अब इट्स सैड.
I could empathize with that as well, because it's been 2 years, but still I'm being, in process to overcome the fact that he's not with me anymore.
I am professional, but still, it's, I had to take a call, but जैसे आपने सवाल पूछा कि ओवरकम कभी नहीं होता है. No.
So do you want to share any happy memory with him? At last, any happy memory?
About my pet?
Yeah.
There's so many things, like if I just recall, not couple of pets I had in my life since my childhood. But सबकी यादें कुछ न कुछ हैं, और सबसे बड़ी याद उन सब की आँखों में जो चमक, जो प्यार, और जो मतलब अनसेड लव जो था मेरे प्रति और मेरी फैमिली के प्रति. आई रिमेंबर दैट. आप घर पहुंचते हैं, घर में घुसते वक्त सबसे पहले जो मिलने को आता है, विदाउट एनी डिमांड, इज़ योर पेट. विदाउट एनी कंप्लेंट, योर पेट. जो उनका हग, जो उनका ऊपर चढ़ना और मिलना, वो शायद एक आदमी किसी को नहीं दे सकता. सो उसको जब नेचुरली उसकी डेथ होती है, दैट्स अ डिफरेंट मेमोरी. वो कॉल जो नेचर कॉल है वो अलग है. जब हम उसको पुट डाउन करते हैं, दैट ऑलवेज गिव्स यू अ लिटिल फील अबाउट इट, कि क्या मैं और कर सकता था. बट वो कर सकता था, वो था ही रहता है, बिकॉज एक मेडिकली एक लाइन भी हो जाती है कि इसके बियॉन्ड कुछ नहीं हो पाता. सो हम लोग मिरेकल की वेट करते हैं. अब मिरेकल कुछ केसेस में होता भी है, कुछ रिकवरीज होती भी है, जो मेरी पिछले 34 साल का एक्सपीरियंस कहता है. कुछ जगह ओनर कहता है पुट डाउन कर दो, हम कहते हैं नहीं करना है, इट विल बी हैपन. कभी हम कहते हैं कि ये पुट डाउन कर देना चाहिए, और ओनर कहता है नहीं, आई विल टेक केयर ऑफ इट. वहाँ मिरेकल्स होते हैं कि वो कुछ वापस अपनी लाइफ में लौट भी आते हैं. बट वो डिज़ीज़ क्या है, कंडीशन क्या है, सिचुएशन क्या है, सब उन चीज़ों पे डिपेंड करता है. सो आई थिंक वो कॉल लेने से पहले हर पहलू को हमें सोचना चाहिए, समझना चाहिए. वी शुड कंसिडर all possibilities before taking a call. That will be my last line to say to you. All possibilities should be considered before asking your vet that I want to put him to sleep. And vet should also take all considerations in mind, that okay, I did this. He should take opinions from others, read books, do his best, and give his best. Then you must take a call.
Doctor, last question. So how does your family overcome with this trauma and how they reacted to it?
When it comes to the family and the veterinarian, it is very tough for me to make, take a call and make them understand. But fortunately, they have some medical background. As my father was also in the medical, me also in the medical, and we always talk about. And they also come from, they have studied the science. It was easy for me to make them understand. Okay, this is the thing I'm going to do, and this is the call I want. But when it comes to emotions, it was difficult for them also to, take a call and agree with me. But eventually they did and understood, yes, Papa, your decision is right and we are with you. We all of us, when we are just sitting over a cup of tea or in the evening free time or just driving and see any dog, though we have 2 dogs already at home, we always remember them. कि पापा ये रूबी की तरह बिहेव कर रहा है अभी, ये देखो जैक की तरह बिहेव कर रहा है, सो शायद ही कोई ऐसा दिन होता है फैमिली में कि वी डोंट रिमेंबर देम डायरेक्टली और इनडायरेक्टली, बिकॉज कुछ जो एग्जिस्टिंग मेरा लियो और लकी हैं उनकी कुछ इमोशंस या एक्शंस या हरकतें ऐसी होती हैं कि उनमें सिमिलर होती हैं. तो कभी कहते हैं रूबी वाली हरकतें हो गई, ये जैक वाली हरकतें हो गई, सो लगता है पापा उनकी आत्माएं इनके अंदर ही हैं, सो we go that way, and I'm thankful to my family also that they were with me in that moment, and we had to take a call. It's not easy that your own pet, you are putting them to sleep. And for me in my practice, the pets which are coming to me as a client, I feel they are my own. Yeah. So attachment, it doesn't mean that they come to you as a client and go. It's not a client for me, it's a partner for me. When it's coming to my hospital DCC, all my pets are partners. And we talk about the same way that pets are partner to us.
Such a wonderful mindset, yeah. So, really sorry for making you cry, but it was very important for us to get to know more about it. We can't thank you enough for these wonderful advice that you have given. And I'm sure like our audience also have more questions about it. So if you do have any more question regarding this, you can comment and reach out to us on Instagram. Thank you. Thank you, Doctor.